Kentucky Department for Libraries and Archives. I see it's 2 o'clock now, so want to welcome you to this session, Strengthening Communities Through Child Abuse Prevention Resources. It's presented by Jana Estep Jordan. She is with Prevent Child Abuse Kentucky, and Charlie has dropped in the link here about how to access captioning. We do have live captioning available for you today. Also want to let you know that today's session is being recorded, as are the other sessions in the other rooms that are today. Sessions tomorrow will also be recorded. And as Charlie's typing in some information there, you can, if a pop-up comes up, you can say yes to see the captions. In addition, if you need to access these slides later, Amy has provided a Google Drive site, and I'm going to drop that link here in the chat that you can access slides from this presentation and all the presentations and information from partners that they've provided resources. So I want to thank Jana for being here, presenting, taking time to share about this important topic with us. And so if you do need help during the session, please use the chat feature. You can access that in the bottom right-hand corner, the purple button. Everybody is muted, but you will be able to chat. And so if you do need to ask a question, please feel free to click on that purple button. It's going to open a little window, and there's a chat bubble there for you to access the chat. And if you have any questions, please let us know. My colleague Charlie Taylor is in here with us, and I think Amy is also with us. So without further ado, I'm going to pass it over to Jana. Thank you again, Jana, for being here.
Thank you for having me. I'm going to go ahead and put my email address in the chat. Should anyone want any specific information or additional resources that aren't provided through this presentation or on the Google Drive. So to get us started, my name is Jana Estep Jordan, and I work for Prevent Child Abuse Kentucky. We are a statewide nonprofit, so we serve the whole entire state. And our main goal or our mission is to prevent the abuse and neglect of Kentucky's children before it ever occurs. So we want to make sure that all families are strengthened so that we never have to make a report of child abuse or suspect it because it won't exist. Now, wouldn't that be an absolutely beautiful world? So our objectives for today are, we want to look at what a basic understanding of child maltreatment prevention is and what programs we have that are available, what resources do we have that libraries can use. And then I also want to provide some concrete strategies and tools for you in your work. Libraries are one of my favorite places in a community. And if I travel a lot for work and if I have in between meeting times, I'll camp out at a library, and I'm always amazed at the various programs or support or help or just things that are going on in that particular library. So I said earlier, I feel like the programs and services that a library provides are such hidden gems, and I just want to promote libraries throughout the whole state. So if you ever have somebody come to the library that's been to one of our trainings, I'm sure that our whole staff has touted some of the support and work that you all do. Now, I mentioned what our mission is earlier, to prevent the abuse and neglect of Kentucky's trainings. Now, we do that through community programs. We offer parent education programming throughout the whole state. And that's a program where somebody does not need to be referred. They can contact us and we can put them in touch with that program. And that is for anyone and everyone. It does not matter their income level. It doesn't matter if they're a biological parent, step parent, a grandparent raising a grandchild, a mother or a father, all are welcome. We also do a lot of public education and awareness, as well as advocacy. And then the other thing I want to mention that is a great tool is our 1-800-CHILDREN helpline. So that helpline is available during business hours, Monday through Friday. And anyone can call that line for resources, referrals, and help from anything in regards to strengthening families, supporting families, and preventing child abuse. Now, since we are a statewide organization, our main headquarters is in Lexington, and we have a small but mighty staff of 9 people. So the way in which we have such a significant reach across the state is through our Partners in Prevention Network. And we have roughly over 260 unique partners, and these partners represent some of the organizations you see in front of you, from Child Protective Services to hospitals, law enforcement agencies, government associations, Toyota, the factory in Georgetown. So it really spans a variety of different associations and groups. So, you know, libraries are one of our partners, but we would encourage you, if your individual library would like to become a partner, would like to receive information, then I would love for you to reach out to me or my co-worker, and that information will be forthcoming as I go through these slides. So in order to talk about our work, I think we have to understand child maltreatment. So you might hear on the news or through daily walks of life, people love to use the phrase, Kentucky ranks #1 for child maltreatment. But I caution folks, because that phrase is like comparing apples to oranges. In the state of Kentucky, we are a mandated reporting state, which means that everyone and anyone in our state who suspects a child to be a victim of abuse or neglect is mandated to report abuse. You know, other states, it's not that way. It's certain professions or their laws can be extremely lengthy to where it's unclear who is mandated. We also have different policies and procedures for substantiating abuse. So I encourage people, when they hear that phrase, to think, okay, that's like comparing apples to oranges. Let's focus on the prevention. Let's focus on what we can do, because one child is too many when it comes to being a victim of abuse. So when we look at the causation of child maltreatment, we see that 74 to 75% of all cases of child abuse are child neglect. And most often, a lot of these cases have to do with families who are under significant stress. They might lack basic needs such as affordable child care or connections that can help them you know, during homework time, or help them with transportation to and from medical appointments. So all these families have all these stressors surrounding them. And what we know happens when those stressors increase, when the resources decrease, families that are a higher risk for child maltreatment. So what does an abuser of child abuse or neglect look like? And what I can tell you is they look like us. Most parents that hurt their children are doing so during the best, or doing their best during tough circumstances. You know, it crosses all economic socio-status levels, from the richest of neighborhoods to the poorest. It covers all racial, ethnicities, and religious boundaries. And it is a myth that abuse is more likely to occur within any particular race or ethnic group. But what I can tell you is that research tells us we know there is implicit bias when it comes to reporting cases of maltreatment. Unfortunately, 53% of Black children will receive a child abuse or neglect investigation by the time they're 18. And we know that those cases are not substantiated. They're what we call screened out because they didn't meet criteria for abuse. So while I say it doesn't occur within any particular race or ethnicity more than others, we do know that we tend to report on people that don't look like ourselves for several reasons. One, we think that people that tend to look like us, worship like us, or run in our same circles couldn't be capable of abuse. The other, when people aren't like us, we tend to think differently of them. Now, child abuse is defined into 4 categories: physical abuse, neglect, sexual abuse, and dependency and emotional abuse. So there's actually 5, but we don't really talk about dependency all that much. So I'm briefly going to go over some high points that might be helpful for you in your library role. Now, we know physical abuse is an injury inflicted by a caregiver. And it is, most often when we see physical abuse, we see things like bruises, burns, bite marks, fractured bones. But what I can tell you is when it comes to babies and children who are 4 years of age or younger, we have this little rule that we call the 10-4 bruising rule. We know that babies that don't cruise, so babies that are not mobile, should not bruise. So it is a red flag, and it's significant if we see a non-mobile baby with a bruise. Now, if we see a child that is 4 years of age or younger, and they have bruising anywhere, that is, or not anywhere, but 4 years of age or younger, that have bruising on their ears, their neck, or their torso, we know that's a red flag and a cause for concern. We have these little protective triangles that start at our head and go down below our abdomen. And when we fall, for example, or have an accidental injury, our fight or flight kicks in and our hands go to reach out and prevent us from falling. So we know 90% of the time when we have bruising on ears, neck, or torso on kids that are 4 years of age or younger, there needs to be a medical evaluation to ensure that child's safety. Now, that's not to say that accidents do happen. So what we know from the research is we'd rather be safe than sorry and adhere to that rule. Now, child sexual abuse is the most underreported form of child abuse because there's only evidence 4% of the time in these cases. And the other thing that I think it's important for us to know, especially when we're working with volunteers or members in the community and hosting events, is that 40% of child sexual abuse cases, the perpetrator is actually an older youth in a position of power or control of a younger youth. So when we're hosting events, we need to be mindful not only of the dangers of leaving adults alone with kids, but older youth as well. And then neglect, again, is the most common form of child abuse in our state. And what I want to say here is I want us to understand there is a significant difference between poverty and neglect. We see that a lot of times families will receive reports of child abuse or neglect because people might be confused on how to help a family. They might see a family where the parents are doing their best that they can with limited resources. That individual might not know where to turn, so they call CPS because they don't know what else to do. So we're trying to get people to reframe the way they think and think of how can I be a community supporter to help families when I know abuse is not occurring. I just know that they have a lack of resources. Most neglect cases that are substantiated involve domestic violence. They might involve substance use. They might involve just the caregiver, not ensuring that child's needs are met. And then last we have dependency, where is a parent, of no fault of the parent, that child is not taken care of. That can be in situations for health issues or severe mental health issues. The top 5 things to remember there is that bruising is the most #1 overlooked sign of physical abuse, that most often abuse happens when parents are under stress, lacking resources, supports, and connections, and that when we think of child sexual abuse, we need to recognize the signs of grooming. We need to recognize when people have ill intent towards our kids so that we can prevent that abuse from occurring. And overall and in general, we need to be vigilant. We need to be a connection and make sure our families are getting the support they need. And we're all mandated reporters. So if we suspect abuse or neglect, please make that report. But I want us to think about moving upstream and being a community supporter prior to that abuse or neglect ever occurring. Now, when we think of moving upstream, there is a little fable, if you will, that people like to share. There's three guys at the end of this stream, and they keep seeing kids that are swimming in the stream that are drowning. So the one guy jumps in and he pulls kids out, but there's so many of them, he just can't keep up with the kids that are drowning. The second guy's like, aha, I'm gonna get a boat. Gets a boat and starts filling the boat with the kids, but he can't keep up. The third guy goes to the top of the stream to see why are the kids getting in the stream in the first place. And that's what we do. That's what Prevent Child Abuse Kentucky is all about, is ensuring our partners, including libraries, understand how they can go to the top of that stream to support our families. Now, here is a graphic. Again, you can download these slides that kind of helps you understand primary prevention. When I talk about reporting child abuse suspicions, that's what we call tertiary prevention. That's responding to child abuse after it's happened. We want to, again, move upstream and support our families before that abuse or neglect ever has that chance to occur. So I'm so excited that I can finally talk about this, but we are launching a huge statewide campaign called Lean on Me Kentucky. And the whole idea behind this campaign is providing everyone in our community with tools on how they can support families. When we look at true primary prevention, one of the common themes that we see is everyday citizens tend to think child abuse is somebody else's problem. It's somebody else's responsibility. It's what Child Protective Services deals with or law enforcement. When what we know is when everyone takes on the role of helping families and kids, we can prevent maltreatment. So this whole campaign is using that lens with the videos, with toolkits, additional trainings and resources to help communities use common messaging and understand how they and their role in their life can support families. So if you would love more information on that, in the coming months, we're going to have a huge launch across the state. I welcome you to be involved in that. You can email me, or you can see the website link here and sign up for our newsletter to stay abreast of that and other resources. So now I want to get us thinking around this community supporter lens. So I would have you think for a minute. This is what we refer to as Sam's story. And this is what we see a lot of times when people might confuse poverty for neglect. So Sam was sitting on the front stoop in the late afternoon evening and was looking a little scruffy, a little disheveled, a little dirty. The neighbor kept checking on Sam through the window. So looking through the blinds to make sure, like, is he still out there? And after about an hour of looking through the blinds and seeing that Sam is still sitting there, this neighbor called the Department for Community-Based Services, or CPS, Child Protective Services. Now the worker came to the house. Sam did not recall his caregiver's phone number, so nobody could reach any of Sam's parents. What they didn't know is that Sam's caregiver was at work and could not get off work. The family member that was supposed to watch Sam was sick. So there Sam is by himself. The family couldn't afford childcare. So we think to ourselves, in this situation, is it neglect or is it poverty and lack of resources? So we're trying, this is what Lean on Me Kentucky is all about, is shifting that focus, where that neighbor looks out the blinds and says, you know what, I'm going to go check on Sam and see what's up. And after talking to Sam, sees, oh my goodness, your mom is at work. Well, you know what, I'm going to hang out with you till mom gets home. So again, we are trying to shift the thought of, we know we're mandated reporters. If you suspect abuse or neglect, we want you to report. But if we know there's a situation that might not be neglect, we want to make sure that everybody is a community supporter and looks to support that family with basic needs, stress management, or whatever they might have at their fingertips to help. So we're going to go through a few tools. So that is our Lean on Me focus, the community supporter focus. But we also have specific tools at our agency that you can use in a variety of ways. And some of the examples I'm going to share with you are examples from specific libraries that we've worked with throughout the state, or what other groups or associations have done. So you might be familiar with Child Abuse Prevention Month. We had a library in Northern Kentucky who put a huge display of materials during Child Abuse Prevention Month and had children color pinwheels, which is the national symbol for child abuse and neglect prevention, and they displayed those all over the library throughout the month. We had another library in Eastern Kentucky that got really creative and had these beautiful pinwheels that they created with some sort of tissue paper on their window, so anybody driving by could see those. So this is a time that we use as a launching pad. We take advantage of this awareness month to see how we can get people to think about child abuse prevention year-round. In January, we plan to have a session that helps people see, okay, this is what Child Abuse Prevention Month is about. This is how I can be involved. We also have trainings and presentations available during this time. We've had Pendleton County had us out to do a training on recognizing and reporting child abuse during the month of April. We also, as I mentioned, have the Pinwheels for Prevention campaign. And that can span anything from planting pinwheels outside to create a visual impact, creating your own pinwheels, or involving the kids and families in your programs. They can make their own pinwheels, they can color them. There's lots of ways to get creative. We also promote the first Friday in April as Wear Blue Day. And this is a time, again, where we try to get folks to think, okay, if I wear blue and I post a picture of myself, or my socks if I don't want my face on social media, if I post this picture, what's an action step that I can give to all of my followers? So I'm not just saying, hey, this is Child Abuse Prevention Month, but I'm saying, hey, it's Child Abuse Prevention Month, and I challenge you to support families. We also have a coordination of speakers and events. We have an event calendar to help promote what you're doing. We also have op-eds, press packets, contests, and then oftentimes we will also have mini grants where you can apply for a grant to receive free materials and information to use within your local community. The other thing that we have is our advocacy network. We advocate for policies and legislation that improve and strengthen families and children, and we intentionally try to connect organizations and others in this work. If anyone is ever interested in this, we also have a newsletter. You can go to our website, and Hillary has posted that link to our website, PCAKY.org. You can find the advocacy button, and then there's a little spot for you to sign up for our advocacy newsletter. Now, we know if you look at research and studies that have shown the usage of seat belts, that have used smoking cessation, so getting people to quit smoking, a lot of these awareness campaigns have been very successful throughout the years. So we look at these evidence-based practices that show how we can promote these messages in ways that drive people to action. So one of the first materials over here that says, are they good for your kids, is an excellent tool to help us look at preventing child sexual abuse. There's an interactive web page on our website where anyone, whether it's a parent, caregiver, a neighbor, an organization, they can go to that website and click through the interactive page to see what exactly is child sexual abuse. What does grooming look like? The process by which offenders groom and gain access to families and children. And what do I do if I see these things happening? It also has information for organizations on how to create policies and safe spaces so that they can prevent the likelihood of abuse occurring on their property. And then it also has tools for parents and caregivers on choosing safe babysitters and childcare providers. We also have a home safety checklist where this tool was created because at the start of the pandemic, there are two statewide groups. One is the Child Fatality, Near Fatality External Review Panel. And this panel looks at all cases of child deaths and near deaths in our state where there might be either an abuse or a neglect aspect. There's another group out of UK that looks at all injuries and unintentional injuries. And what they were seeing is that we had an increase in unintentional injuries related to home safety. Things like access to water, firearms, ATV incidents, access to prescriptions and drugs, whether it's prescribed or not prescribed, was significant. We saw a huge rise in those cases. So this home safety checklist was created as a tool so that families and community members had something they can use to educate caregivers, parents, as well as community members on what they can do to ensure that home safety. We also created a water safety video and a brochure to address those water safety injuries. I think most people don't realize that 1 in 4 water injuries are the 4th leading cause of fatalities for youth spanning all age ranges. Now, organizational materials, we have worked a lot with library entities over the last decade on a few of these materials listed here. One is our Internet Safety Toolkit. So we have a Internet Safety Toolkit that is available on our website, or you can get on our website and order it. That toolkit is pretty lengthy. It's about 20 pages, so you're going to get information on everything from the dangers that are found on gaming devices, because we know a lot of times parents don't realize or think about the access that people have to kids just through their gaming devices. It also looks at using the internet. What apps do people need to be aware of? The other one is reducing child sexual abuse in youth-serving organizations. So again, that's helping people identify what grooming looks like, procedures and practices to lessen the risk within an organization. And then our most recent project is engaging fathers. We actually, if you are in Louisville or surrounding counties right now till the 21st, we have a grant opportunity where you can apply to receive funding to host a fatherhood event. So please email me if you want information on that. So we have tools on how to engage fathers, as well as many grant opportunities and trainings and more. Now, other examples from how we have worked with libraries in the past. I love summer reading programs, and we've had several entities that will order our materials, or they will download them and copy them on site, and they will include that in their summer reading program kits. Or if they have, I remember it was right when the pandemic hit, and they would have that great take and make project. There were libraries that would include information for parents in those take and make projects that people would pick up and do at home. We have, tracked partner events. Again, we have over 260 partners. So we've had our libraries or our partners contact us and say, we want to network and collaborate in our community. Who do you know we can collaborate with? You know, I mentioned the tables and information areas. use of social media, engagement events, and then we also provide technical assistance on various projects, topics, and provide that one-on-one support when needed. And again, provide those educational presentations. Those have been either to library staff, or libraries have hosted events and have either contacted us to ask for speakers on certain topics, or have used our staff expertise to do a training. So now the virtual tools that can be promoted or used include, again, there's that water. Again, 1 in 4, fourth leading cause of child death spanning the age ranges with water. So we have a water watcher video that's kind of a fun, unique way to get people thinking how to be a little bit more intentional of being safe around water. We have a safe sleep practices in preventing abusive head trauma video. So this is an 11-minute video that helps new caregivers understand the dangers of unsafe sleep practices. You know, sudden unexpected infant death is something that is on the increase in our state. And that happens when babies might be on unsafe sleep bedding. So they might be co-sleeping, they might be in a crib or somewhere that's ill-equipped, that has a lot of stuffed animals or toys. So this video goes over all of that information that new parents need to understand. And then the final video listed here is the safety and awareness for everybody video. And this is kind of twofold. We have a lot of folks who will say, you know what, I'm a parent and I don't know how to talk to my kid about body safety. To be honest, people will say it creeps me out. I don't know what to say. I'm uncomfortable. I don't know where to start. So we created this video and an accompanying educational checklist or tip sheet as a tool that people can use. The interactive tools below are also some great resources. There is one, again, that is specific to organizations. So if you want to go on that quiz and see, is my organization equipped to lessen the risk of child sexual abuse? You can go to that online quiz, 7 quick questions to see what you are doing that is awesome or what you might need to grow and do a little bit better on. And I see we have a question. So if you want, I don't know if you have the capability to unmute or to type it in the chat, but I want to make sure I get to that question that popped up.
Please, if you do have a question, you can type it in the chat.
Yes. Whatever makes you more comfortable. So I will keep on talking and I'll wait for that question, or again, unmute and ask it if you feel comfortable to do so or have the capabilities to do so. Here, this just goes over those organizational interactive tools and quizzes that I mentioned. And again, there's one for organizations and then one for parents. So if somebody is confused about how do I look for a babysitter or ensure who's watching my kid is safe, that's a great quiz for them. Now, the other thing that we promote or that we do is what is called a no-hit zone. And this is a great opportunity because we get a lot of questions from organizations on, if I see a situation that might be escalating to potential violence, I don't know what to do. So the no-hit zone is a program that looks at influencing attitudes, norms, and behaviors to ensure a safe environment. So it's associated with a specific location or facility. So a library, for example, could be a no-hit zone. And what it is in that zone, no adult shall hit an adult, no child shall hit a child, no adult shall hit a child, and no child shall hit an adult. So it's a program created so that entities can have signage that state just this, what you see on the screen in front of you, but it also provides a training to all staff and volunteers on what to do and how to react if they see situations that could be escalating towards violence. It is a great program, and one of our board members, Dr. Kelly Dock, is on the National No Hit Zone Committee. She's fabulous. We have a full page dedicated to this project on our website and a free training on our website if folks want to learn more and find out more about what a no-hit zone is, or if you yourself are interested in being a no-hit zone. Now the trainings, oh my goodness, I could not list all of our trainings on a slide and I would take up too much time. So I've highlighted just a few of the offerings that we have. Now, my favorite are our online trainings because people can take those at anywhere or at any time. And one of those trainings is Understanding Healthy Child Sexual Development. We have a lot of questions about, especially when individuals work with younger kids who might see kids acting or behaving in a certain way. They wonder, is that normal? Should they be doing that? Is that a sign of child sexual abuse? And conversely, we also have situations where folks want to better understand what kids should be doing at each of those developmental stages so that they know what to do and how to nurture and ensure the safety and well-being of kids. This is an excellent online training. We also have the internet safety training that is free, available online. Report to Court, another free online training, is a training specific to what happens from the time a child abuse report is made to being investigated to they might be working with a family. It also gives tips and tools on how to recognize child maltreatment virtually. So Zoom and opportunities like that, since our world has shifted so much over the last few years. And finally, we have the No Hit Zone training that I just mentioned, where if you might be interested in becoming a no hit zone or learning what it's all about, that is an excellent training to take, and it's only about 58 minutes. And as mentioned previously, you can contact us if you want to host a training or work with others. We have anything from recognizing and reporting child abuse. Our Lean On Me project that we're getting ready to launch, we'll have trainings with that. Are They Good for Your Kids is devoted strictly to the prevention of child sexual abuse. Internet safety. Now, this is a new training. It's an evidence-based curricula called QPR, and it's suicide recognition and prevention. So what signs are you seeing and how do you respond? The Preventing Child Sexual Abuse and Youth Serving Organizations, home safety, building resilience in families, and then engaging fathers. Now we have about 20 other trainings, so feel free. The handouts that are on Google Docs, I think it's Google Docs or Dropbox, whichever platform it is, I made sure that the PDF that I sent in had active links. So you can access these training slides and you can directly see these links for any of this information as well. And then you can also look to localize your partnership. I mentioned earlier that we partner with libraries at that statewide level, but if you wanted to be a partner on a one-on-one level, if you want your library to be a partner and receive information as it comes out, we would love that. We do that with health departments, family resource centers, schools, and more. So our partnership is basically, we just provide perks and information to our partners. When we have trainings that cost money, we give discounts. We usually have free items each year that we provide to our partners that help develop the caregiver-child relationship. Up at the top right portion of your screen is this year's, which is a bookmark that also has seeds that you can cut off of the bookmark, and the families can go plant those seeds and watch them grow together. And it's also a bookmark because we know the significance of encouraging literacy in our families. We give social media shout outs, website publicity to our partners. We do our best to try to find funding opportunities or mini grant opportunities to provide our partners with funding so that they can do projects at that local level, receive materials. We have partner awards and then a first to know. So anytime we put out a new resource, a new training, if there's a new study or information people need to know on prevention, we usually send that out to our partners so that they always have that information at their fingertips. And then we do referrals too. So if somebody wants to volunteer in Union County, we look to our partner list and connect those folks with that specific county. If a funder, we've happened before where somebody contacts us and says, we want to do a toy drive, but we're in Covington, who would you suggest? So we'll give them a list of our partners and an explanation of what they all do. Now you can, if you want to become a partner and receive that information, you can email me. My contact information is there, or the email address on the screen. Amanda Royer is our manager of partner relations, and she would be just thrilled to talk with folks. We have partners in every county in Kentucky, except we do not have a partner with a physical presence in Garrett County. We have entities that serve Garrett County, but not a physical presence. So if you are in Garrett County or you know someone in Garrett County, you would make our day, our month, if you could connect us with somebody in that county. So that is a short tutorial of just kind of a glimpse of the programs and services and tools that we have available or forthcoming. I would love to answer any questions you might have or clarify anything further. And again, use that chat box or unmute if you can.
Thank you, Jana, so much. And I'm excited to have you here today. And I've actually worked with one of your colleagues who are going to come and present at an adult services meeting next year for a group that I work with. So glad to have you here, and thank you for all this information.
Outstanding. Thank you.
Folks, if you have any questions, please feel free to use the chat. Questions about partnering or what ways that your library can connect and support the work and that is related to preventing child abuse. I really appreciate, Jana, the story about Sam and how.
Oh,
yeah.
Good. And I'm already have emails popping up. So this is excellent. So if you have emailed me recently, it just popped up on my computer screen. So I'm excited.
Wonderful. Well, we've provided Jana's email here, so if you have any questions additional, think of later, I think it's probably okay to reach out to her. And just a reminder that this session was being recorded, and those slides and so forth are available that Jana has provided, that you can download them. They're available at that Google Drive site that Amy created. So not just Jana's presentation, but the other presentations from this conference are there. And the recording for this will be available later. And thank you for being here.
Thank you all so much, and I hope you have a fabulous remainder of your conference.
Thank you, Jana. Folks, those are still with us.